Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. Before starting today's topic, a request to all of you. I have already uploaded on the YouTube that because of my mistake there was technical error and episodes from 34 to 60 of Clinical Ayurved were not available to all of you. So I have rectified that error and now all the episodes from 34 to 60 are available to all of you. Just type Clinical Ayurved by Dr. Mayuresh Agte and episode number 35, 36, 37 and you can go through that each and every episode. In this 35 to 60 we have discussed many aspects, mainly rasa, vipak, virya, prabhav. Each and every rasa has been discussed, their clinical application, their indications, contraindications, their lakshana of rasa and their use in the diseases are discussed in this full series. Then I have discussed about vipak, limitations of vipak, different types of prabhav. We know only prabhav means that there is no karyakaran bhav. We can understand or we can logically prove the karma and rasa virya vipak and their relation, but there are other types of prabhav also, and that matter is also discussed in this series about virya. Then I think samam pratyarabdha, vichitra pratyarabdha. So all these topics have been discussed in these episodes. So I request all of you, please go through all these episodes and also give your suggestions, opinions, and give likes also. So from lecture number 34 to 60, please go through them and you will get much more information about the clinical Ayurveda of rasa, virya, vipak, prabhav, etc. So let us now move towards today's topic. We were discussing Kasa Vyadhi and I have discussed Pran Udan Gati Sangarsha, which is mentioned in the Samprapti. When we are discussing Samprapti right from Charak or Ashtanudaya Mavanidhan, you will come to notice that main importance is given to the Vata dosh. Even the Hetu which are told in Mavanidhan are Ativyayam, Rukshanna, Bhojanasya Vimargaman, then Shavatho, etc. All these again indicate towards the Vata Prakop, and that Pratilom Vayu comes out of the Kantha as a caste disease. But in my opinion, this Samprapti, yes, this is regarding mainly with the Vata dosh. In practice, you have to think of other Samprapti also. What is that? It is mainly related to the Kapha dosh. Urasthan is of Kapha dosh, all of us know. So when there is congestion of the Kapha dosh in the chest, in the lungs, because of that avrodha of Kapha dosh, the Vayu becomes Pratilom, it can't get Sancharitva is obstructed, and so it becomes Urdhagati and comes out of the kas, out of the Kantha, making noise, and we know that as a kas. Especially in the small babies, when there is Kapha Kal, you will find this congestion often, and here many times you will not see the Hetu like Rukshan, Ativyayam, etc. But the kas is there because of the Kapha Sanchiti. Even in the rainy season, we always come to know that there is fever with the cough and there is bulging, their sputum is going outside continuously, etc. In that case, you have to think of Kapha Pradhanya and obstruction of Kapha dosh to the Vata dosh in the Pranava Strotas. So, first Samprapti is Adha Pratyoto, where we have seen it may be a Malavrod and Apan Pratilom gives strength to Udan and Udan Pran Gati Sangarsha, or Hetu like ice cream, winter, cold, AC, etc. Shita Gunatma, which will create vata prakop, and then it will increase udan and pran, and there is gati sangharsha, and then udan will make pran to flow in the its upper direction. And third one is mainly kapha pradhanya. There is kapha sanchiti, and this kapha sanchiti will make अवरोध in the pranavas होतं. So sancharitva of vayu will be obstructed, and this obstruction will make the vayu vimargaga, and it will come out through the kantha as a kas. So always remember, whenever there is patient of kasa, auscultation of the chest is very important, because just with the sound of the cough, many times we can't get the actual kapha sanchiti, and for that auscultation of the chest is very important. There is another samprapti. I will not call it as a samprapti as such, but in Lakshana of the caste, you come across the patients that there is no any kapha sanchiti present in the chest. Chest is clear. Chest is clear. There is no as such obstruction. First thing, so rule out, kapha dosh is rule out. Secondly, hetu like shita, sevan, etc. Or also you will find that patient says, no, I have not eaten anything which will increase the var, but still there is kasa lakshan, and it is related to this only kantha bhag. Complete pranasotas is not affected, only kantha bhag is present, and in that patient's typical answer of the patient is, when I talk to someone I get cough. When some air passes through my oral cavity, I get coughing immediately. Now here you will not find that any lung or any kapha sanchiti, only this portion of the kantha is affected, and that irritation of the kantha as an organ creates the kasa vyadhi. You may say as it is a lakshana instead of vyadhi, but you will find only these things affected. In this case, examination of the throat is very important, whether there is any redness or any itching, first thing. And secondly, very important factor which is often ignored in these patients is galashundika buddhi. The uvula has got swollen, and that swollen uvula touches the back side of the pharynx and creates the irritative cough. And for that, examination of the oral cavity or pharynx is very, very important. In this case, mainly when patient sleeps down, then at that time in the sleeping position, that elongated uvula touches the back of the pharynx, and patient typically says that after sleeping down I get the irritative cough, and of course it is always dry. There is no any sputum or like thing, but this factor is very, very important in the case of patient, because it is often ignored. So when you are treating with the cast vyadhi, first see malavarot for apanvayu, then vata prakop for pran udan, then kapha sanchiti for any obstructive pathology in the pranavasotas, then oral cavity for the galashundi vruddhi, and which is creating the cough as a lakshan. So kas vyadhi, you have to think these four factors. Now in our practice, you have to deal with another major cause or symptom, and which is allergy. If there are 3-4 persons, we are living in the same atmosphere, but when there is fan is on or AC is on, or some curds or some cold food is taken, patient starts coughing, person starts coughing. Now other 3 persons which are eating the same thing, living in the same atmosphere, do not get that cough, but only that person gets cough, and that starts immediately many a times. So sanchaya, prakop, rasar, sthana, samshaya, which are the steps of samprati, are also not seen. Something is eaten, like dried some bread or some toast is eaten, and that starts irritation curve immediately. So in practice, we call it as a allergic bronchitis or allergic cough. How you will how you will design this samprati or this lakshana of the patient in in the principles of Ayurveda, and what will be the solution to this allergy, sinusitis, allergic cough, whatever, how we will diagnose allergy in our principles of Ayurveda, and what will be the solution for it, we will discuss in the next episode. Thank you very much.